My name is Justin Willis. I'm from Seattle, and I went to University of Washington for medical school, and then I did the Alaska track through Seattle Children's for my residency. Recently graduated, and now I'm attending here in Bethel at the Yukon-Kuskokwim Health Corporation. In my attending job, I do both inpatient and outpatient pediatrics, so I'll have the opportunity to work with residents in both settings. I was always looking for an opportunity to do more primary care pediatrics through residency. And unfortunately, a lot of pediatric residencies are very inpatient focused. And I knew that I wanted to do outpatient pediatrics when I was done with residency. The Alaska track through Seattle Children's has the most primary care training of any training program in the country. And I loved the opportunity to have essentially an entire year of my residency be learning how to do outpatient pediatrics. And along with that, have the opportunity to have 6 months of that outpatient pediatrics training to be with Native population. And I knew that that was an opportunity that I wanted to do after residency. And so having the opportunity to work with a Native population throughout residency was really high on my list, and it really drew me a lot to the Alaska track. But I think that adds to the Bethel charm. There's like ATVs blaring.
Excuse me, like during this edit, we have to pause for buses.
Should I be drinking like orange colored water too at the same time? Coppery.
With a hint of lead.
Ooh, I got a little lead. Yeah. So I gotta get the lead out of my teeth, yeah. I decided that I wanted to be in Bethel after really my third year here. And I saw how the pediatricians were truly general pediatrics trained, and they were full scope general pediatricians. They have the opportunity to do critical care in the emergency department. You do lots of procedures. You get to do inpatient medicine, and then you also have great bread and butter general pediatrics. And there is truly an incredible need here for pediatricians that want to do full spectrum outpatient and inpatient pediatrics. And so I felt like after my training through the Alaska track that I was prepared to do full scope general pediatrics, and I was excited to continue to do that through this job. And so the combination of working with the Native population as well as being in Bush, Alaska, and being able to do full scope general pediatrics was what kind of led me here to YKHC. So I think by far the most unique part of this side in particular of the Alaska track, and my favorite memory of being here is doing the village travel and the medevacs. And so as a resident, our residents get to go on medevacs to go and pick up patients who are in villages and that need to come to Bethel for a higher level of care. And we get to ride on the plane with the paramedics, and we get to be there and involved in their care. You get to sit in front of the plane and get to see really incredible villages and talk with the amazing people in the villages themselves. So on medevacs, you get to go out and see all the different villages around the region. And then for village travel, your first and your third year, you get to go and spend a week in a village and getting to know the people in the village and the health aides there, and having a closer understanding of what it's like to live in the village and the homes where the kids are living. You start to understand the different challenges of medical care in Bush, Alaska, and start to get to know the families a little bit better. So then when you see them in Bethel, they have a better comfort of seeing you because you've been in their village and you know where they're living. And so that is really unique, I think, about being here in Bethel, is being able to do that and getting to really explore Bush, Alaska. For me, Bush, Alaska is just like very rural Alaska and off the road system. So there's no roads to get here to Bethel. You have to fly here. And so almost all travel, both into Bethel and out of Bethel, is by plane. In the winter, there is an ice road. And so you can use snow machine or snowmobiles. And you can also drive on the ice road. In the summer, you can go by boat to the different villages, but it does take quite a bit of time. And so essentially all the travel, medical travel, is by plane. And so no roads to Bethel. And but there are 6 miles of paved roads here. The school-based health center, the Bethel Youth Clinic here at the Bethel Regional High School, actually was started through the residency program. The very first year of the Alaska Track residency, they worked with the city and worked with the school, as well as YKHC, to build this clinic for it to be a clinic for both the middle school and high school students here in Bethel. Since that time, it has slowly grown over time, and over the last 3 to 4 years, we have been part of a grant through the Alaska Public Health to help improve this clinic and help improve access to the students here at BRHS. And so the grant has helped pay for the furniture that you're seeing here, and it has helped improve our capacity here at the clinic. And so when school is in session, we are here 2 to 3 days a week. We've had dental here to do dental checks, and we have medical providers here 2 days a week. And then our public health department also comes and helps with STI screenings as well as immunizations. And so we do school physicals and any acute checkups. What is a really awesome opportunity for the residents is that as you go into your 3rd year, you actually get to be here essentially on your own and working with one of the pediatricians and doing a lot more hands-off precepting. And so you get to put yourself in a role of being an attending, which I think is really important as residents. And we don't often get that opportunity when you're in a more inpatient setting with in the tertiary care center. Being in a smaller town area and training here, you get to have the opportunity to have a lot more autonomy, and it has really benefited me going into being an attending, having had these opportunities to work with patients and actually make decisions on my own, and really making sure that I feel responsible for those decisions. Coming back to here, having trained here for 3 years, is a really great homecoming kind of for me. I feel very comfortable coming back to Bethel, and I have familiar faces, there's familiar patients, and I know the system, and so I feel very lucky to be here and start my career as a pediatrician in a place that I already know. And so I'm excited to be here long term and get to know patients even better. And a benefit for the residents, and it has been a benefit for me coming back too, is the longitudinal experience. Having come back here multiple times, you get to see similar patients, you get to follow up with those patients, you get to go to similar villages, and I get to do that same thing now as an attending and help create that continuity and learn what it actually means to be an outpatient pediatrician with continuity.